Welcome to another episode of Exercise Matters with me, Randall Cooper.
And me, Mick Hughes.
Support for today's episode comes from Premax Performance Skincare. If you're active, you focus on strength, endurance and recovery. But what about your skin? Sweat, friction and the elements take a toll. That's where Premax comes in. High-performance skincare made for high-performance people. From recovery creams to anti-chafe balms, massage creams to exercise-specific barrier creams, we help your skin go the distance. Keep your skin as fit as your body with Premax. Available now at premax.co.
And support for today's episode also comes from Learn.Physio. Health professionals, are you staying ahead of the game? Learn.Physio brings you cutting-edge education from world-class experts in sports and musculoskeletal medicine. Online courses, hands-on practicals and expert resources, all backed by the latest evidence and designed to fit into your busy schedule. To be your best, learn from the best. Get started today at Learn.Physio. Good morning, mate.
Good morning, Mick. I've got to say off the bat, are you ready to do this again?
I think I'm always ready for this, and I've got a funny feeling the second time around is probably going to be better than the first.
For our audience, we've already done this. We've recorded the double episode of Plyometrics, and Mick actually knocked it totally out of the park, which he always does. But we've had some technical difficulties, and we're going to have to do it again. So I think we're going to be better the second time around because we've already had the dress rehearsal mix.
Yeah, well, don't put the mocker on me, mate. It's don't curse me. Let's see how it all goes. But the talk on plyometrics hopefully has sunk in and a bit better now. It's had a bit of time to marinate for the last month while we're waiting for it to be published. And unfortunately, we had a few gremlins get into our system and cause it to glitch. So here we go again, round two.
Well, I think that the comments that we made when we did the first episodes was that, again, it's very much been thought of plyometrics, and I'll get you to define it in a minute, but plyometrics has very much been kind of in that realm of rehab and sports medicine and probably very high-end athletic development for a long time, but it is making its way into the mainstream. And I'll give you an example because even this morning, my 16-year-old daughter, who's very, very keen on her tennis, and she knew nothing about us talking about, plyos in this podcast.
Yep.
And she said to me, "Dad, are you able to give me a plyo program for tennis?" I was like, "What? Where did you find this out?" And she said, I just think that it'll really help kind of my tennis. Would you agree? And it's like, yeah, well, why don't you come up and sit next to us while we talk about this for the next hour and a half?
Yeah, the kids are all right. The kids are going to be okay if a lot more teenagers are hearing about plyometrics and it's becoming a commonly used word, and it's associated with increasing speed, increasing performance, decreasing injury risk. If they're well aware of it from the early days, I think the world is going to look like a brighter place in the years to come. No, that's really cool. I must admit, I grew up playing basketball, and there were jump programs getting around. You'd wear these stupid shoes on your feet that used to, put some stress on your calf muscles. You'd have the kangaroo boots that you could use to, enhance your jumping ability. There was all these top secret programs that you could download off the internet for, $150 a pop. I had these dreams of just being an NBA superstar and dunking on everyone. And to this very day, I've never dunked. It's just probably not in my genetic makeup, but
you must go close because you're 6'2", you're 6'2" or 6'3", aren't you?
Yeah, but I've certainly got a lot more slow twitch muscle fibers than fast twitch. I'll let you know. I've been able to hang off the ring. That's probably as close as I ever got, I think, in my peak athletic ability. But I was never able to get the ball up over the ring enough to slam it down. But I'd come across it in my teens, and I did some jumping programs. And funnily enough, I felt the effects of overdose of plyometrics. I had a really cranky patella tendon there for a while because I'd too hard too soon and thought more was best and all that kind of stuff, which we'll talk about a little bit on today in terms of dosage. But I'd known about it for a while, but I didn't really get to understand it until I was in my exercise science years. And that's probably where I have associated it as more in that high performance world, but it's nice to be able to sort of have my physio hat on and today and talk it through with you, because I think there's general population but also young early career clinicians that just may not be across plyometrics very, very well. I know I didn't learn about it at all at university from a physio perspective, but from an exercise science perspective it was there. The funny detail about plyometrics though, I remember there was always this kind of quoted figure that you have to squat 1.5 times your body weight to be able to start plyometrics, which was kind of taken as gospel, I think, for a large chunk of my exercise science years. And I remember reading that quote and thinking, gosh, there's a lot of people out there that just won't be able to ever do plyometrics because they can't squat that much. But we'll talk about that today and how that figure is often misrepresented in the world of plyometrics. And yeah.
And I think that's part of it, following on from my comments at the start, I think that's been a thought amongst a lot of health professionals and fitness exercise professionals as well, is that you only do plyos if you're an elite athlete. If you are terrific at what you do, it's going to take you from being awesome to exceptional, and it's not for everyday people. But I think that we need to myth bust that today and say that plyos, yes, you do need a base level of strength. You do need some base level of fitness. And if you've been sitting on the couch for the last 2 years on Netflix, then just don't go out and start doing box jumps all day. But it's something that can make a significant difference to your athletic development and also your athletic performance if you do them appropriately at the right time.
Yeah, and reduce the risk of injuries too. So we'll talk about that as well.
Which is our
probably
bag.
Before. Yeah, that's right. But before we probably get into it, like just leading into that, like there's plyometrics and there's plyometrics. Like there's low grade, low intensity stuff, and there's a lot of great blogs out there that I've come across, and a lot of really clever sports science people and S&C coaches that I've learned a lot from the time, and people that spring to mind, Lockie Wilmot from Athletes Authority and Matt Buckthorpe. They've got stages of plyometrics that go from the really low intensity, really safe, effective ones that can be done a bit more frequently to the more really high intensity shock method stuff that really needs to be done really carefully and under some really strict supervision. So I think that's probably what we want to sort of get a little bit out of today too, is not put plyometrics all into the same conversation and
Great point.
have this really silly high standard that you have to be able to squat 1.5 times your body weight before you even consider doing it. So a bit to tick off today, so much so we have to break this into two parts. So we'll tick off what plyometrics are, we'll tick off how it can improve your jumping ability, how it can then improve athletic performance, how it can improve some strength qualities of people, how it can actually enhance some running qualities as well in our middle to long distance runners. Then move into injury prevention and how it sits in that space. And then finally, at the end of part two, wrap it up with the dosages. So how frequently, how many jumps per session, all that kind of stuff. So, setting the scene already, you could probably understand if you're a listener out there that we've got to get to a lot to go through. So that's why we have to break this one up into two parts.
Sounds great, mate. So just give us a definition of exactly what a plyometric is. I'm sure there's a number of people who are listening or watching just going, I've got no idea what they've been talking to up about this point. We're 8.5, 9 minutes into the podcast.
Yeah, well, the term plyometrics actually, it's kind of, if you break it down into two Greek words, plython, which means to increase, and metric, to measure. So it's effectively to increase measurement. So it's often used in performance circles to run faster, jump higher. And then the Russians, very famous Russian coach, Verkhoshansky, hopefully I pronounced that correctly, termed plyometrics as shock training or jump training. But effectively, if you break it down, you've got three components to a true plyometric exercise. So you have the pre-stretch phase, where if we use a counter movement jump, which is probably the most common plyometric exercise out there, the counter movement jump, where we're dropping down really slowly and lengthening and your body seeking effectively energy storage, so it can actually then eventually turn into a release into the air. So we've got this pre-stretch cycle, which is phase one of the plyometric cycle. Phase two is a phase called amortization phase, and it's effectively that kind of brief moment where your body has stored the energy and it's about to release. A really important part of the plyometric cycle is to really minimize this phase. So we don't want to have a long amortization phase. So if we use a counter movement jump where we've dipped down, we've reached the low part of our jump, we don't want to hang here too long. We're effectively doing what's called a squat jump then if we're staying in that squat position for too long. So we want to dip down, put the stretch on the muscles, get that all energy storage release, minimize that lag time before we then move into phase three of the plyometric exercise, being the shortening phase or the concentric phase, where your body then effectively recoils and shortens and explodes you up in the air. So that's the plyometric exercise broken down into three distinct parts. The purists out there will kind of also say that a plyometric exercise is determined by that really short time on the ground, literally milliseconds. We've got to really make that as quick as possible. And we've certainly had some healthy debates in the past about a box jump, as not being a plyometric exercise. And that's often what people would sort of say, colloquially, if I ask them questions in the clinic, are you doing any plyometrics? And they'll say, yeah, I do box jumps, or I'll do some broad jumps. And it's like, okay, well, it's a good start and it's a good place to learn. But I guess by strict definition, we're not really training your body to release that energy really quickly and repetitively as well to get the great benefits out there. So that's plyometrics, I guess, in a nutshell, if we're setting the scene here.
It's that I've always used the example of the kangaroo. Like the kangaroo just bouncing along is just plyometrics probably at its best, where essentially they're using the elastic recoil of their muscles and their tendon and musculotendinous units to essentially just propel themselves along often. And that is very powerful in sport, isn't it? When you think about kind of the ability for, you use the example of basketball, to be able to kind of like jump and be able to touch the ring, those athletes are exceptional at their plyometrics.
Yep. Yeah, they've just got this wonderful ability to, generate energy in their muscle tendon unit, particularly their tendons, to then use that energy storage via some complicated processes within the body that involve lots of things that probably not everyone needs to understand and get to know. But that energy storage is really vital, where we get that lengthening and we get that quick release. So having really, stiff tendons in a way, and that's where, the whole concept of stiffness and tightness needs to be really considered, because having a stiff tendon that can really store energy and spring it off is really, it's actually a positive. Stiffness often gets sort of used in a really negative tone, but to have stiff tendons is actually a really positive thing. And you see these beautiful athletes that have got these beautiful stiff tendons that just go bounce, 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 bounce. They have very minimal contact time on the ground, and they've got these wonderful muscles that have got really high levels of fast twitch muscle fibers that can stretch a muscle really quickly, store that energy, and then release it, and be wonderfully athletic. So that's kind of how we sit with plyometrics.
How much of that can be trained, Mick, and how much of that is innate? Like you think about those guys who do unbelievable vertical jumps, or the best NBA basketballers who just kind of take 3 steps and they just bound and kind of. Yeah. How much of that is just they're born with it, and how much can you train if you're not good at it?
Yeah, I don't have the exact figures, but there's certainly known elements of some people are just blessed with that natural athletic ability. We've got definitely racial differences between Caucasians and African Americans. We've got higher levels and Asian populations as well. Actually, remembering from my exercise science days, if we look at the breakdown of fast twitch muscle fibers, which have a huge influence in plyometric ability, Asian populations and African populations have got a higher breakdown of fast twitch to slow twitch muscle fibers, where our Caucasian populations definitely have a lesser, shift between fast and slow. So there is going to be some genetic influence, and there's going to be some ability to train. And if you were untrained, you would be able to train the ability to jump higher at any given rate. And it's effectively a skill as well. So to learn to sequence the movements to jump in effect. And I've seen this in the clinic all the time. You get people who have never jumped before. Part of the improvements that we see when we check out their jump heights over a course of a month is the fact they actually haven't changed much of their muscle properties and their tendon properties, but what they have recruited really well is their neuromuscular system, and their nervous system is just on a little bit sharper. So now they're using their muscle units in much better sequence so they can jump higher. So I guess to answer your question, there's going to be a certain group of the population who can just sort of rock up and be athletic, and they can get better naturally, and they probably have a better advantage as it starts. But then probably more so our Caucasians population have probably got to work a bit harder for it, and the ceiling effect for them is probably just going to be a bit lower than what our African and Asian populations will have. So there's definitely some racial differences there between groups when it comes to the.
I think also my experience would be. Yeah, my experience would be also that most people haven't done a lot of this in their training unless they've been in performance sport for a long time, and most people can improve markedly by doing these exercises if you do it in a nice progressive way, in a safe way, like you've kind of outlined with the guys with Lockie and Matt's protocols. I think that's really important. Let's dig into some of the studies that you looked into, Mick. I think that the first topic you're going to look at is how plyos can affect strength, was it?
We're going to talk about jumping first. So we've got so we've got a really nice systematic review conducted and published in 2020. So this was a really nice, strong meta-analysis and systematic review looking at jump training on the outcome of improving jump height. Now, this population was volleyball players, but we would be pretty comfortable in saying that if in volleyball players we're seeing a benefit in jump height, then across the board we would also see improvements in any athlete that wants to jump higher, be it a basketball player, be it a soccer player who wants to sort of get a bit higher up and head the ball, any kind of athlete there. But this research was specifically done in the volleyball population. Now, they looked at 14 really good randomised control trials that compared those volleyball players that did plyometrics versus those that didn't. We ended up having about 300 volleyball players that were looked at across the board. The results that came in were overwhelmingly positive for yes, plyometrics did improve vertical jump performance in volleyball players for those that did the plyometric training versus those that didn't. Unlike some other topics we've talked about in the past where we've looked at percentage differences, be it a 10% improvement, 20% improvement, such and such, this body of work didn't give a specific percentage, but rather talked about large effects, moderate effects, small effects, no effect. So it's just a different way of looking at things. And ultimately, the role of plyometrics that had on vertical jump performance in volleyball players, it was a significantly large treatment effect of the plyometric work being done. What I loved about this breakdown was that they looked at some dosage requirements here to get those large positive effects in the volleyball players. So they looked at studies and they found that the studies that conducted at least 8 weeks of jump training, at least twice a week, showed the greatest benefits. They also commented that the total number of jumps probably didn't make a huge difference. So whether or not you do as few as 40 jumps per session were their comments there. I would probably take that with a grain of salt though, because it depends on knowing what we know about really high intensity plyometric work and some of the more brutal jumping exercises that can abuse your musculoskeletal system. Your body does need some rest. So I would sort of temper that in saying that more is not necessarily best, but they did quote a figure around about 40 to 50 jumps per session seemed to be the sweet spot for dosage if we're doing 2 sessions a week. And we're doing it over an 8-week period. There were no differences between males and females, and there were no differences between being younger or older athletes too. So across the board, an overwhelmingly positive result here for improving jumping height in volleyball players, no matter the age of your athletes and no matter the sex of the athletes as well, which is really cool.
I was going to say, isn't it interesting that they that in a group of athletes such as volleyball players are probably one of the most plyo/jumpy activities going around. You're always spiking, you're always kind of doing plyometric style movements within that sport. So you'd think that these athletes at a baseline would be pretty good. And then if you're going to then start to train on top of it with additional plyometric exercises, you'd think that the effect size would only be small to moderate.
Yep.
So for it to be more than that is a really powerful study and statement saying that you can get exceptional benefits from doing plyos, even if you do plyos type movements within your sport. Train it and it gets better.
Yeah. Absolutely. That's what I found fascinating about that. And you're right, these guys are going to just have this natural, they're going to be tall. They're already going to be sort of in a sport that's already giving them a really good stimulus there. So you'd think the ceiling and the benefits there would be, very marginal. But exciting work here to entice our vertical jumping population into getting some good work in. The other positive from this paper was that, and this goes across the board for a lot of the other things I talk about today, is that they look at safety and any downsides and negative effects to the plyometric training. And they found that the plyometric training was safe and effective, and there were no injuries reported in the studies, especially when the dosages are really controlled. And I think that's where we look at these clinical trials, and they are very, very controlled. We're having 2 to 3 exposures a week. We've got our jumps accounted for. And when done with the right dosage, we have the effect. And I think where we see problems lie clinically is where people take that kind of broad message saying plyometrics are beneficial, and sometimes they take that and sort of run with it a little bit too far, and they think more is best. But we know plyometrics need to be done in a really good set dose, and the frequency per week is really, really critical here. So from a safety point of view, very safe, very effective. But we always sort of use the caveat that the dosage needs to be really, really spot on here. So, really, really cool work in volleyball players.
Yeah, no, I agree. And, from a physio's perspective, we're always looking at tendons and also musculotendinous kind of junction areas where if people do plyometrics too aggressively, too quickly, and that's where we'll tend to see that kind of the issues arise. So if you are doing plyometrics as part of your program, always, a little bit of soreness is always fine. But if you're getting excessively sore kind of in your tendon areas or lower down around the tendon area, like the lower part of your calf, for instance, then probably get it checked out and make sure that you're not doing yourself some damage.
Yeah. And the big one for plyometric training, more often than not, is we're going to see a rise in patella tendon pain. Patella tendinopathies are almost exclusive to jumping athletes, basketball players, volleyball players, hurdle jumpers, triple jumpers, really high dosage abusive loads to 2 or 1 leg at a time. And my brief stint with patella tendinopathy came on the background of discovering the joys of plyometrics and doing 5 sessions a week for about 3 or 4 weeks in a row, and having a really cranky left patella tendon. So surprise!
I didn't know that about you. You had a crappy patella tendon. How old were you
when I was 18? When I was 18 or 19, thinking, that was my trying to dunk stage of life. So, I no longer have that stage of life or goals. So.
And has it been good since then? Have you had any issues since being 18, or was it just that flare at that stage and it was a reactive tendon?
It was a completely reactive tendon. Yeah, completely reactive tendon, settled with deloading and rest and not being so silly with my exercise dosage. And it was sort of gone within about 3 or 4 weeks and back to normal, never to be seen again. So I was one of the lucky ones, but I had a few mates growing up that really had really debilitating periods of patella tendinopathies and Osgood slatters and all that kind of stuff. So I was one of the lucky ones.
Yeah, good.
Moving on to basketball and probably taking a slight change of pace we're evolving now into not only just looking at plyometrics and how it can improve vertical jump performance, but also how it can play out in improving qualities for performance in sport. So this one was a systematic review in basketball players, and it looked at not only jump height, looking at the benefits of jump height, but also to changing of direction as well. So this was a really, really cool paper, cool systematic review. 32 different studies were looked at, those that compared plyometric jump training to those that didn't in basketball players. Same things that they were looking at, small, medium, large effects, and specifically plyometric training, played out in basketball players could jump higher. They were also faster. So they had a much faster sprint time and they had faster changing of direction, all moderate to large improvements in sprint time and changing of direction. They also had better balance scores, moderate to large improvements there in balance. And they had a slight increase in strength as well when they looked at some of their strength measures as well. So it was really cool. That was probably maybe an incidental finding there with that, but that was a really nice, thorough review of the potential knock-on effects to plyometric training outside of just improving your ability to jump high in the air vertically. So got faster, more agile, better balance, better strength. Similar to the volleyball group, they did find that the dosage 2 times a week for at least 6 to 8 weeks was a sweet spot to see that benefit. This group, however, did find that older teenage players, so 16 years or older, so we're not talking really old, but 16 years or older, tended to see the bigger improvements in their jumping ability and their performance measures than those that were younger. So that was something there. And there was there were no difference between the sexes. I'm sorry, I was about to say there were slightly differences between males and females, but no differences between males and females. So the only difference here older better than younger. So, another big win for plyometrics for performance measures. Following up for this, males and female soccer players, once again, for performance measures, we're seeing large to moderate improvements in speed, particularly in soccer players. The first 5 to 30 metres were improved with plyometric training when they were conducted twice a week for at least 7 weeks, and obviously vertical jump height improvements as well. This paper was a slightly better, I guess, in determining percentages and that kind of stuff than the other papers I already discussed. But male soccer players can improve their jump height by up to 9% is the figure quoted here from this systematic review, which is probably a clearer idea as opposed to having large effects, moderate effects and small effects. 'Cause sometimes they might get lost in translation what that actually means, but to see an up to 9% improvement, which was good. So that was really cool. So jump height improves 9%. Sprinting first 30 metres improves with plyometrics in male soccer players. Female soccer players, similar treatment effects. We're seeing not only faster sprint times, faster change direction times, but also better kicking performance. So another simple performance measure there in the female population. So really, really cool. So in a nutshell here with our soccer players, both males and females, 1 to 3 sessions of plyometric training per week, minimum 6 weeks, maximum 12 weeks to see some really good significant gains in speed, changing of direction, agility, kicking performance, all these beautiful measures to improve you as a player on the field, and all reported to be safe when the dosage was right. Big wins across the board. It not only can make you jump high, it can improve your ability on the field or court.
Yeah, I'm glad you highlighted those studies because I think that again, one of those misconceptions I think is that plyometrics is all about just jumping up in kind of vertical lines. So if you're a volleyballer or you're a basketball or a netballer, do your plyos because that's what you need in your sport. But this research is very clear to show that essentially it's going to help soccer players, AFL footballers, hockey players, any of those, even tennis players.
Your daughter's tennis.
Any of those. Yeah, that's it. Coming back to the start. She's right. She needs to do plyometrics. So I'll put her onto this episode because it's good.
Please do. It's funny you say that. Like just the random people that listen to my show. I've got a side note, completely going on a tangent here. But one of my gym buddies that I've just grown to train with recently, he was like, "I heard you talking about high intensity interval training the other day, and I thought that was pretty cool. That you talked about that, and the effects of creatine and protein, and I like how these messages we're sort of bringing to the general audience, mate. And it's cool to see even the young ones, even your teenage daughter, getting around this kind of work. So it's nice to be able to break down some of that tricky research and put it into the eyes and ears of the general population as well as the health professionals out there. So that's nice.
I often use the example of Formula One with a lot of my patients, and that is that you can learn a lot from the way it's done at the top of an activity or a sport, and what they learn out of Formula One definitely goes into people's everydays, Ferraris and Fords. So it's the same with exercise, I think, is that yes, these guys who are playing professional sport all day every day are exceptional because they're good at what they do, but they also train hard. But you can integrate a lot of what they do into your own activities to improve your performance substantially. And plyometrics is just one of those things, And again, it's very digestible, isn't it? In that if you can do 2 sessions a week of 40 to 50 jumps, and that's what was in the volleyball study, it can make a significant difference to your athletic performance. So, great research.
Yep, awesome. We might pull up stumps there on part 1. That'll probably do us about 30 odd minutes. That'll probably be enough for everyone to sort of take on board, and we can have a little cup of coffee and recharge our batteries for part 2. And we'll come back and finish it off.
Sounds great. You want to read us out there, Mick?
I better read off. I was going to just tease people with what's coming up next, but if you were there at the start, you know what's coming next anyway. Yep. So that's a wrap for this episode of Exercise Matters. If you enjoyed the chat, make sure to subscribe, leave a review and share it with your mates. A quick disclaimer, this podcast is for educational purposes only and is not medical or individual advice. Always seek guidance from a qualified health professional for your specific needs. A big thanks to our sponsors Premax, high performance skincare for high performance people, and of course Learn.Physio, world class education for health professionals. We'll catch you soon.
See you again.